50% chance higher risk of developing those cancers. And this is when I'm like, this is serious. Hi guys, I am Danny Cat. Welcome back to my channel. And if you're new here, don't forget to subscribe so that you can see all additional Danny Cat content. At the end of this video, feel free to give me a thumbs up if you liked it and comment on whatever your heart desires. And I say that with caution. Full disclaimer before I begin, I am not a doctor. I do not practice medicine in any way, shape, or form. None of this is medical advice, but feel free to receive it as encouragement if or as need be. You're probably wondering why I'm sitting in the car. No reason. I like the lighting from the sun. No specific reason. Today's video may not be as entertaining or exciting as usual. Honestly, I don't even have any notes for today's video, or not many notes for today's video. I'm kind of just speaking from the heart. As you can tell from the title, I have a lot of recent updates on my health. And so with that being said, back in 2021 or 2020, I honestly believe it was 2021, I was diagnosed with a rare disease called Fraumeni syndrome. I'm going to give you guys the definition from Google. So Fraumeni syndrome, which we call LFS, is an inherited familial predisposition to a wide range of certain, often rare cancers. This is due to a mutation in a tumor suppressor gene known as TP53. The resulting P53 protein produced by the gene is damaged or otherwise rendered malfunctioning and is unable to help prevent malignant tumors from developing. And if I say anything wrong and you know the correct way to say it, you know the correct way to say it. Children and young adults are susceptible to developing multiple cancers, most notably soft tissue and bone sarcomas, breast cancer, brain tumors, adrenocortical carcinoma, and acute leukemia. Other cancers seen in LFS patients include gastrointestinal cancers and cancers of the lung, kidney, thyroid, and skin, as well as gonadal organs, ovarian, testicular, and prostate. It is important to note that not everyone with a TP53 gene mutation will necessarily develop cancer, but the risks are substantially higher than in the general population. 50% to be exact, y'all. A diagnosis of LFS is critically important so that affected families can seek appropriate genetic counseling as well as surveillance for early detection of cancer. So how I found out that I have this condition, I went to my gynecologist just for my regular checkups, and she basically was like just doing my breast exam. And so as I was talking to her, I was just telling her like my mom's history with breast cancer. My mom had breast cancer twice, 2 different types of breast cancer and 1 in each boob. So I was letting her know that history and my mom's young age when she developed it, which was 34 and 44, I believe. So as I was telling her this, she was just like, that's kind of like a red flag usually because of her age, and then her also developing it 2 different types of cancers. And I'm like, a red flag for what? And so she's like, we typically like to do genetic testing when we see those type of things, multiple cancers and young ages. I guess it gives them a red flag that something in the genes is wrong. So I was like, she was like, have you ever been tested for the BRCA gene? And I told her, no, I had not been tested, but my mom had been tested, and because my mom was negative, they said that I did not need to get tested for it. If you are used to this, you're getting your screening and getting your boob checkups, then you probably heard of that. My mom was negative, like I said, so they said it was not necessary for me to get tested. So my doctor, she's like, well, we usually test all of the genes nowadays. It's not just the BRCA gene. Like, there's a lot more to it now. So although your mom was negative for the BRCA gene, she was like, we'll just test you just because. And then also we'll test your whole panel of genes just to see if there's any mutations. She said most likely it'll be nothing, and it could be just like a shocking rare case of your mom just being one of those ones. But let's just be safe and get your genes tested for anything. So I'm like, okay, cool. Not thinking anything of it. Probably a week later, she called me and she was like, I'm so sorry. I don't have the best news. You do not have the BRCA gene. I think I'm saying that correct. I don't know if they say you have the BRCA gene or you don't have a mutation in the BRCA gene, but I'm going to keep saying it how I've been saying it. I don't know if I'm saying it wrong, but you know what I'm talking about. If you get your screening or testing, whatever. She's like, although you don't have the BRCA gene, you do have a mutation in your TP53 gene. So at the time, I did not understand what that even means. I'm like, okay, I have a mutation in the gene. What do we go from here? Like, so she's like, I'm going to forward your information over to a genetics team and they'll give you more information on this. Even still, I did not think this was as serious as it was. So once the genetic team contacted me, and the genetic counselors and stuff like that, they were just like, yeah, so with this genetic mutation, it is very rare. They said it's very rare. And you're at risk for darn near every cancer that's out there. And I'm like, okay. And they're like 50% chance higher risk of developing those cancers. And this is when I'm like, this is serious. So they tell me that most likely I inherited this mutation, especially given my mom's history with cancer. But there's also a chance that at birth, I could have just, the gene could have just mutated on its own. They said if it was inherited, then that would determine if I'm considered to have the syndrome Fraumeni. If it was not inherited, then I would not be considered to be a Fraumeni syndrome patient, but I'm still at a higher risk for developing these cancers. That's the best way I can explain it. So after that, they were just like, okay, your mom needs to get tested for this genetic mutation as soon as possible, because we do believe that you inherited from her based on her history. And then also you both need to start screening ASAP. So I'm like, screening? They're like, cancer screening immediately. So my mom went and got tested for the genetic mutation with her oncologist, and she was also introduced to a genetic counselor. And then all of my stuff was forwarded to a new genetics counselor team, and as well as a new team of doctors. And when I say a new team of doctors, I mean like doctors for the lung, doctors for the stomach, doctors for the brain. All of my stuff was forwarded to a whole cancer team, and then I have a doctor for each area of the body in that team. And then after this, it was just like everything just kind of took off from there. And that was like the beginning of a whole new life. Once my mom got her results back regarding her genetic panel, it did confirm that she did have the mutation. And then that also confirmed that I got my mutation, or I inherited my mutation from her. Okay, so now we have that cleared. Moving forward, it was time to get through with screening. My doctors and her doctors, they're basically like, from this point on, for the rest of your life, you all have to get screening, cancer screening, full body cancer screening every 6 months. This included breast MRIs, full body MRIs, brain MRIs, like every 6 months. In addition to that, we had to get colonoscopies and endoscopies, and also we have to see a dermatologist to review or look over our entire body for any signs of skin cancer. It's insane, but it's necessary to stay ahead of things and be proactive to make sure we're not developing any cancer. This has been our routine since we found out that we have this genetic mutation. This year when I went for my screening, they saw with my chest MRI or my full body MRI that there was a spot on my lung, my left lung. And so they were like, okay, we see a spot on your left lung. Have you been sick? Have you been feeling okay? And so I explained to them I did just have an upper respiratory infection, or a common cold, because I had actually passed it to my baby boy, and we had recovered pretty well. I had a cough for 2 days, and then my baby boy was sick for about 5 to 7 days. Nonetheless, we recovered very well, and we were good. I was not having any additional symptoms. And so my oncologist was actually pretty happy to hear that, because she was just like, okay, maybe this is just some type of infection in the lung that hasn't yet cleared up. So we're going to give it a few weeks to clear up, and then we're going to take you in for a CT scan. I'm like, okay. We waited a few weeks. I went in for the CT scan, and then she calls me back a few days later like, we don't think it's an infection because it's still there. An infection would have cleared by now. So she was like, it's looking a little bit more like a nodule, but we cannot confirm yet if it is a cancerous nodule. So at this point, I'm a little afraid, of course. I'm like, a lump on the lung. Okay. And this is not what I expected to hear, especially a lung. You know, when you hear anything about the lung, you think, oh, if you smoke cigarettes, you'll most likely see something like that. But there's more to it, obviously. After that, they decided to do a biopsy. And so I recently went in for the biopsy. And after I came out, the surgeon confirmed we did see cancer cells in the nodule. The pathologist was in the room, so he was able to let them know, like, if they're getting enough with the biopsy, and kind of be able to view, or kind of was able to view everything that they were doing as they were getting the samples that they needed. And that's how they were able to confirm right away, like, we did see cancer cells. They did say that they were not able to see much with my lymph nodes, but because they said my lymph nodes were too small. But what they could get from my lymph nodes, they said they didn't see any cancer cells in them. So yeah, as of right now, it's kind of just like the waiting game. As I said, they confirmed they did see cancer cells, but I'm waiting on like the full pathology report. And also, I've been scheduled for a PET scan to scan my entire body for any additional cancer cells anywhere else in my body. As of right now, they believe that it looks like an early stage of lung cancer. And that's where we're at with it. Early stage could be stage 0, and it could also be stage 1. I'm not sure exactly which one it is as of right now. PET scan will finalize everything else that we need to know. It will help determine if there's any additional primary cancers anywhere in my body, and or if the cancer cells from the lung nodule have spread anywhere else in my body, and especially into my lymph nodes. So once I do that, then they'll kind of have a plan of action for me. But they do believe that it is early stage, as I said, and that we're looking like surgery may be the only thing I need. I do encourage people to, if you have any history of any type of disease or disability or whatnot, get your genetics tested, guys. A lot of people genuinely don't even know that's possible. I didn't even know that that was possible until this scenario. And if it wasn't for my doctor and my nurse practitioner being on it about knowing their stuff and listening to their patients for signs of this type of stuff, I would have never gotten that genetic panel done, and then I would have never known that I was at such a higher risk of developing a cancer. I'm 28 years old and I have lung cancer. So it's important. It is the same as when they test people for the BRCA gene to see if you're at a higher risk for breast cancer. It's as simple as a blood test. They send it in and then they go through, I guess, all of your genetics to see if there are any mutations. And basically, the doctor or the genetic counselor can discuss with you what sickness or disability that you are at increased risk of developing at some point in your life. It's very fascinating, to be honest, what the genetics will, or what your genes will tell you. I'm hoping that they come out with some sort of treatment for not only my genetic mutation, but many genetic mutations. Guys, there are so many out there that I did not know about. There are so many. And I've been reading up on things like gene therapy. And if we can get the ball rolling with gene therapy, I'm telling y'all, the future is looking bright. We will be able to cure not only things like cancer, but people with disabilities who are like deaf or blind. They'll be able to hear and see because we'll be able to fix the gene that's defected to get the body to do what it's supposed to do. Yeah, like I said, real fascinating. I know y'all don't care about that, but yeah, that's where we're at with all of this, guys. I will keep you all updated on what we do moving forward. What's the next plan of action? Like I said, they're thinking about surgery. It might be the only thing I need in my case scenario, but I'll keep y'all updated. Talk to y'all soon.